Hi, I'm Kristen Tamplin with Muscle Activation Techniques, where muscle movement matters. Today we'll be using muscle activation techniques to address the client's low back issues and tightness. So we'll go into muscle testing. Testing leads us to whether or not the muscle is functioning efficiently. If it is, we'll move on to the next muscle. If it's not, I'll palpate where that muscle originates and inserts, and then go back and look to see if that range of motion has opened up. We're going to be looking at your range of motion first. I'll have you start with your arms at your chest, and I'm going to have you rotate one direction as far as you can. And then I'm going to have you rotate the other direction as far as you can. Good. Come back to center. So there looks to be a little bit of a tightness as he's rotating to his right. Another range of motion test would be, we'll rotate to your right. You're going to side bend this shoulder toward your hip. Come back up, come back to center, and rotate to your left. And side bend, shoulder to hip. And then relax, come back to center. Again, it looks like there's more tightness on his left side from that side bend. I'm looking at range of motion again for his low back. I'm going to have him side bend to the right. Come back to center. Side bend to the left. Come back to center. He looks pretty symmetrical right to left for side bending. Next, we're going to go into muscle testing. I'm going to start at his ankles, and I'm going to be applying a pressure, and he's resisting me at that same pressure, and we're trying to figure out if the neuromuscular junction connection is working correctly. So I'm going to be pulling at your ankles. I will have you get into a couple different positions. I'll walk you through that, okay? First position, you get to lay where you're at. When I say hold, you're going to be pressing out with your left leg, okay? Ready, hold, good. So resistance was nice and strong, so we're going to move on to the next muscle. I'll have you hip hike on your left side. Relax. Keep the hip hike though. When I say hold, you're pressing out with that left leg again. Ready, hold. So that one tested weak. All right, that last muscle tested weak, so I'm going to have him flip over, and I'm going to palpate where that muscle originates and inserts, and then we'll come back and retest it. So I'll have you flip over onto your stomach. Arms, however comfortable. Now I'll have you flip back over. We're going to retest that one. You're going to hip hike on your left side. You're pressing out with the left leg when I say hold. Ready, hold. Good, nice and strong there. Muscle responded very well to the muscle activation techniques. When the muscles test strong, that means there's no treatment needed. So we move on to the next muscle in the series of that range of motion. Now that we're done with the series of muscles, we're going to go back to the beginning and look at his range of motion and make sure that the left side that was tight is more symmetrical to the right side. He still has a little bit of tightness in that side bend, so where I would go from here is to look more into his upper back, maybe into his lats, or up into the upper thoracic. If you're experiencing any tightness, range of motion loss, pain, joint instability, if you're pre-op or post-op, I would love to talk to you about how MAT or muscle activation techniques can help with that and alleviate some of your discomfort. I'm Kristen Tamplin with Muscle Activation Techniques. Thank you for watching.